We'll just go ahead and get started, and hopefully Dr. Robinson joins shortly. But I'll just start off with what we're doing here today. So today we're having a panel, and it's discussing being a minority male in medicine. And so we have Dr. Nelson, who is a current assistant professor in the Department of Family and Preventative Medicine, as well as sports medicine at the University of Oklahoma Health Science Center and OU Health. He is from Little Rock, Arkansas. He went to medical school at William Carey University College of Osteopathic Medicine and is an alumni of the University of Missouri Family and Community Medicine Residency and Sports Medicine Fellowship. His area of interest includes sports medicine, exercise and nutrition, ultrasound, education, mentorship, ambulatory and inpatient medicine. Currently, he's involved with sports coverage from the high school to professional level, as well as teaching and mentorship. In the spare time, he likes to relax with his wife, Raven, their 2 children, and dog, Bishop. We have Dr. Bradley. Dr. Bradley is a critical care anesthesiologist and certified healthcare ethics consultant. He completed residency and fellowship at the University of Chicago Medical Center and 2 years of training with the McLean Center for Clinical Medical Ethics. Dr. Bradley is currently an assistant member of the Moffitt Cancer Center and assistant professor of medicine at USF Morsani College of Medicine. His research interests include perioperative healthcare disparities, ethical implementation of artificial intelligence, and ethical approaches to complex medical decision. So thank you so much for joining us today. And we can just get started with a few questions. So our first question is, what unique challenges have you faced as a Black man in medicine, and how did you overcome them?
You can go first.
Thank you. First of all, thank you so much for the invitation. Thanks for having me on the panel. And hopefully the things that we say, the conversations we have will help you all wherever you may be in your journey. So some of the things that I've encountered, I guess, from the beginning, being a Black man in medicine, is having very little direction. I'm a first generation medical student or physician. And the start of my journey was very rough, not being around practicing physicians, not having any contacts in the field. I came about, I was a year into college before I thought about becoming a physician, and I had to kind of seek out guidance and mentorship along the way. I didn't really understand what guidance and mentorship looked like or should look like for somebody that's going into medicine. So a lot of my support in the beginning did not look like me. I was fortunate to attend Howard for medical school, and that really changed the trajectory of my career. It really showed me what true mentorship and sponsorship looked like and could be, and what it meant to be a Black physician and to be surrounded by Black excellence there at Howard.
I would echo a lot of what Dr. Bradley said. Been around early in the career. Not a lot of people look like me. Have to get mentors who are not the typical people who kind of come to mind. But they were still able to help me obviously get to where I needed to be. And then as you kind of progress and you start finding, people who not just look like you, but allies. You kind of find that stride and find that motivation. And you start to feel more comfortable and feel like you can do, you can do it just like anybody else. And then it just becomes kind of more that perseverance, kind of finding what you want, your area of medicine, focusing in on it. And I think Dr. Robinson is waiting as well.
Hi, Dr. Robinson. How are you?
Aloha. Thank you. Sorry for the delay, but couldn't get in. I'm an old timer, and this new platform is totally beyond my knowledge. So I managed to struggle through it. Happy to be with you guys.
No problem. So sorry about that. And I'll just give your biography, and then you can also answer our first question. We weren't too far into it. So Dr. Robinson is a retired neurosurgeon. He completed medical school at Howard University College of Medicine before completing a transitional year in neurosurgery residency at National Capital Consortium. He was the first Afro-American neurosurgeon trained by the USA military. His first assignment as a neurosurgeon was Tripler Army Medical Center in Hawaii. He and his wife elected to live in Hawaii, where he met and befriended Dr. Ralph B. Cloward, Hawaii's first neurosurgeon. He also interacted in some way with most of Hawaii's neurosurgeons. He became president of the Hawaii Medical Association in 2016, and he has authored a couple of books copyrighted by the USA Library of Congress, Two Ropes and The History of Hawaii Neurosurgery. He is retired from active neurosurgical practice in 2016 and currently resides with his wife in Hawaii. So thank you for joining us.
Glad to be here. And I think the first question was the obstacles reached by Black males in the field of medicine.
Yes.
Simple answer, plenty. And the way you get past them is don't get hung up too much with the race, but try to be the best. And it sounds simple, but think about it. When people come to physicians, they always want the best. And that's what I experienced in Hawaii. Fortunately, I managed to perform relatively well. And the reputation grows patient by patient. And next thing you know, I have one unique experience I share with you briefly before I shut up, is that patients were coming in looking for the Black one. That was a totally different sphere for me. I was a department head at the time, and to have that happen caught me by surprise. So I had to actually deal with it because I have trained my partner at Walter Reed, and he was pretty darn good too. And I worked for Kaiser Permanente in Hawaii, and if I had to have a neurosurgeon on myself or my wife or children, he would have had to be the neurosurgeon. So I wouldn't have liked for my wife to show up and look for the Black one because it would have been me. So it is just a matter of common sense. Uh, the Napoleon effect for Black males and probably females as well has to be recognized. You don't have the option still to just be a decent doctor. You got to be outstanding. And that's sad, but true still, from my opinion.
Thank you so much for sharing. Our second question is, minority men may face microaggressions and stress more often in the workplace than those of other ethnicities. As a result, what advice or strategies do you have for effectively navigating instances of discrimination from other healthcare workers or patients?
I'll jump. And first, Dr. Robinson, honored to be in your presence. Your name precedes you. I wonder why it looked familiar. I'm a Navy veteran myself. Was stationed at Portsmouth for 4 years. Worked with Dr. Benita Simpson, who is a Black woman neurosurgeon there at Portsmouth. This is 2018 to 2022. And my brother was stationed out at Pearl Harbor. He's in the Navy also. So thank you. Honored to be in the presence of greatness. And talking about discrimination and being treated differently from your peers, for me, what I've used to navigate that is to always try to really understand my shortcomings, my limitations, my failures, and my faults kind of before anybody else does. I had a couple situations in residency where, I think along the path you have these interactions, and for us, it's always, was this racist? For women, was it racist? Was it sexist? LGBTQ? Was it any of the, pick any of the three? And as I mentor people, or what I did in those experiences was to myself be true. Was there an issue internally? Did I screw something up? I was always very much aware of the problems that I had or the faults. So my first question was, when there's an issue, is it valid or not? If it is a valid issue, sure, I need to work on that. But also, what happened with everybody else when they made that mistake? As a medical student, as an intern, you're going to make mistakes. We're all there to learn. But when I messed up and you messed up, something different happened. That's a red flag. Or I didn't make a mistake in the first place, and now you're coming at me crazy. So those are the kind of how I started to navigate that process. I had some issues with in-training exams. I was fortunate because another person in my program who did not look like me, we both had the same issue. So we were both in trouble together, and together we were both supported by the program and got through it. But that's kind of how I start deciding, where I want to go from here. Did I mess up? And if so, am I being treated differently, fairly the same? And how do we go from here? Mentorship, as we alluded to earlier, and sponsorship can come into that next step as you determine an action plan.
I'll try to add a little bit. I think once again, following Dr. Bradley, he hit the nail on the head. Kind of reflected on a couple of issues I ran into in training. I would say you want to be an advocate for yourself, but you want to do it in a way that you're comfortable with. Some people like to be a little bit more outspoken. Other people like to it in a professional way. Other people may want to just go up the chain of command. I would identify whatever approach kind of fits your personality and yourself as a person, a learner, and a future, provider. Stick to that. So for me, I had an issue in residency where I was working on a paper and I was communicating out and nobody was communicating back. And I made sure to continue to communicate, even though I felt like there were some issues happening, mostly because of, potentially my race. And I also, went up the chain of command appropriately. Things didn't work out how I wanted to, but I still, looking back on it, I feel like I handled the situation well, and I wouldn't change anything. So just be aware of that.
I'll just add my comments, which confirms pretty much everything you both have said. You first have to be honest with yourself, and you have to adjudicate the situation based on how it appears to you without fooling yourself. You know what you're dealing with, and you know you're under the microscope. But when you're right, you're right. I had an interesting experience as an intern. I was a straight surgery intern at Walter Reed. And I was a bit on the timid side about expressing myself. I'd be quiet even when I knew the answer and the others were wrong. The chief of surgery called me aside one day and he told me he could see by the look on my face I knew the answers, but that I had to exert myself at all times. And he understood as a Caucasian that I was reserved. So he unleashed me to be able to adjudicate the situation, be honest with yourself. And when you're right, stand up for right, but do it diplomatically. Unfortunately, I still feel that Blacks, male and female, have to be very careful how to meander the situation today. Still, not as bad in the good old days, but still not fair. Folk have a tendency to think that you have to prove yourself to be intelligent. And as an old timer, looking back in history, I keep telling myself that, and this is a little facetious, but for me it's real, that when you look at the origin of man, As a spiritual person, I am a Christian and not embarrassed about it. I don't Bible bang, but the cradle of civilization, the people were not Caucasian. We went to study medicine from everywhere, from America and every other country to Egypt to learn medicine. And so we really have nothing to be ashamed of, but we do have to exert ourselves because we are who we are, as intelligent, if not more so, than any other species on the planet. And so you have to be a bit humble with it still, but you can't be too timid. It's my 2 cents worth of addition.
Thank you so much for that. And so you all have talked a bit about mentorship a little bit. So I wanted to ask, how have you attempted to connect with people of your ethnicity and gender or others in your career? And what role has that played in your career? And what advice do you have for students who might be seeking mentorship?
Is that directly to me or to all?
It's to all.
Okay. I'll be quiet. What do what the younger minds have to say about the subject?
I guess we can keep the same order. When it comes to mentorship, I struggle with this because I don't really work well with mentors. I don't have a lot of like longitudinal relationships, but I have been blessed to appreciate the importance of that over time. It first happened kind of at Howard, where we're coming from a PWI. I experienced faculty that was truly invested in my success, and I showed up and I had a mentor, a big brother, and I'm like, I don't need a big. I got a brother and 5 sisters at home. I don't need a big brother, a big sibling. What is this? Dr. Amari Young. He's the program director of OB at Howard now, and he provided all of the textbooks that I needed and a study plan. And I started figuring out like, oh, okay, this is nice. And I can, by the end of my time at medical school, look back and see that I would not have had the success that I would have had if it weren't for him. Dr. Bill McDade, he was attending the one Black anesthesiologist at University of Chicago where I trained. Had an interaction with him in Packy one day where he asked how my intern year was going. And I had the opportunity to say, yeah, everything's fine, and keep on moving, or be honest and vulnerable and say, well, actually, I ran into this issue. And when I said that, he said, yeah, I know. I heard about it. He already knew. He was just checking to see if I was going to be real vulnerable or wanted help. And from that point in 2014, when I was an intern, to now, our relationship has matured. And he's available for whatever I need. So mentorship for me was a little slower to develop, but I can look back and see how significant a role it's played in my success in my career thus far.
I would say I had some strong Black mentorship early on in my career in terms of pursuing medicine before medical school. And, they were obviously very integral to having me see somebody who looked like me and acted like me, and they made it, I can make it too. But had a little bit of a different experience, not a whole lot of Black physicians just in my Black male physicians in my kind of journey through medical school and residency and fellowship. But like I mentioned before, those mentors are still there and they're still out there, and you do have the ability to find allies that, while they may not see the world through your eyes or go through the same, trials and barriers and issues, just because you may look a little bit different, they still can provide, a different voice and a different perspective. And I feel like I've thoroughly benefited from finding those same mentors in medical school and residency and fellowship, and now even as my first job attending. So, I would say for me, my outlook on being a mentor as well as being a mentee is, as a mentee, if I saw someone that I thought had potential that I could gain something from, I would reach out to them. I would be pretty active in saying, this is who I am, this is what I want to do. Can I do this? Can I shout at you? Can I see how you do this procedure? That kind of thing. Now as the mentor, it's a little bit different. I just recently started my job, so I haven't had a whole lot of opportunities, but hope to be a resource for multiple people in the future, if possible. But that's what I got.
Well, I'll just comment that be careful when you ask old people questions. And at 79, I rank as an old person. Um, Looking back experience-wise, the mentor word is one that's absolutely essential, and you can talk forever about it. But when you reach my age and have had the opportunity to be mentored and to be mentor, I can add a little bit of interest to the conversation. Um, I was an integrationist, one of the first few Black people that went to a state all-white university in Tampa. And every lecturer would show up with his notes and the podium. And got fast forward to Howard University College of Medicine. Every physician was a mentor, whether they knew it or not. For the most part, the first few lectures I got no notes, just straight out of their head. And I still paled in comparison to trying to live up to that standard. I mean, I was blown absolutely away, because when you're an integrationist and you get a chance to go back to a predominantly Black university for any reason, people have a tendency that maybe you so loud or that you didn't hold up the flag and keep trying to show that I can do it because I'm Black. But when I got to Howard University, it was like a rebirth, and it just stimulated the heck out of me. And I'm still, to this day, still competing with LaSalle DePaul and Jack White. These guys were legends, and I had the opportunity to be taught as well as mentored by them. Even though I don't know whether the word mentor ever showed up in their brains, they did it automatically. And I was at Walter Reed as an intern, and Dr. LaFall would come as guest speaker and just blow everybody totally out of the water, just routinely. So what that did for me was say, don't apologize for being Black. Just be the best you can be, and then let that speak for itself. Now, with that philosophy, I've had many opportunities for people to ask, will you accept the student? Or even at Kaiser Permanente, I ran into a locum who was a Howard University graduate, the only Black doctor, maybe two Black doctors on the staff before I showed up, and he was one of them. But he was a locums, and there's a female. I think she was from a Harry, but they've also set a pattern of mentorship just by being outstanding. And I since they knew they didn't have the option to be mediocre. And I'll leave it right there. You're going to mentor when you show up Black in a place that got predominantly other races, whether you want to be or not. So just represent yourself. No apologies. Just be the best you can be. And you're going to attract mentees, as I still do to this very day. And I'm second time around being the Honolulu County Medical Society president. I got a few days left. Can't wait to finish it up. But they won't turn you loose when you do the right stuff for the right reasons. Not self-aggrandizement, just thinking about others. I started hiring Black doctors in my department because I became department head at Kaiser Permanente. I became neuroscience department head. And I started inviting Black physicians. I looked for them like a headhunter. And I tried not to do anything other than hire the very best. And let me tell you, that was wisdom beyond my years, because when they showed up, they had that chip on their shoulder I call the Napoleon complex. And that just allowed them to be those kind of docs where the people knew no better, sad, but they come looking for the Black ones. And I think over time, that sort of attitude gradually get America to where it really needs to be. America needs to be mentored through history. No country can survive fighting itself. We almost proved that with the Civil War. So we can be black against white, against Asians, against whatever. We all Americans right now. We're struggling with that problem. So just represent. You want to be the best because that's what professionals are. And that's mentorship all by itself. Trust me. And I'll stifle myself.
I want to add a little something that I did. I trained under Cornwell and Fawcett in the fall, and Calendar gave the fall presentation as a third year medical student. But for the medical students that are listening, because this is what SNMA is geared towards, understand the impact that you can have just by talking to that person that's below you. By that I mean that undergraduate student that's interested in medicine, that high school student that's interested in medicine, because you never know when that little conversation happens, that will be the spark that 6, 7, 8 years down the road, that person that's finishing medical school or going into residency is going to say, oh yeah, I talked to that medical student. They took time out of their schedule to answer my questions, even though the questions were silly at the time, but they cared enough. And that little interaction can be such a significant piece of mentorship and increasing the diversity in our profession.
Thank you for that. That is very helpful advice. Another question is, can you share a memorable moment when you felt your presence made a profound difference to a patient, peer, or community?
Do we want to keep the same order? Because I have one that comes to mind. So like I said, I recently new attending, just graduated from fellowship in July. Learning the patients who are letting me kind of assist them in their care and their kind of journey through life. And multiple interactions I have, just maybe based on my location, they're usually pretty excited to see a Black male kind of walk in the room. And there was one specific interaction where we were discussing some lab results and imaging, and she just, for whatever reason, felt like I was able to connect with her and kind of give her that comfort that she feels like, for whatever reason, she was potentially not getting from other providers that she's seen. And I think that is more than likely purely because of what I look like, that I'm a Black male. And there's not a lot of us, at least where I am in Oklahoma City. And so, I think you might feel like you have this pressure to go that extra step and, be that great Black doctor, but just be yourself. Just be present with the patients that you take care of and the people you meet and see. Just like Dr. Robinson and Dr. Bradley were mentioning, just you being there and being a face somebody can see is going to go a long way. And I think that's huge for patients, at least on that primary care side of things that I see day to day.
Yeah, I can share. During my fellowship, so I was at University of Chicago on the South Side, a lot of gun violence, victims of gun violence, and one patient in particular, South Side YouTube rapper, and he'd been shot kind of through the back of the neck. He had a C-collar in place and had a tracheostomy at the time. And I came on to service in the ICU. We were trying to wean, get a full neuro exam so we could clear his C-collar and then progress him to weaning the ventilator and so on and so forth. Every time they stopped sedation, he would become very agitated to the point that, for his safety, it'd restart sedation. And it's been going on for 2 or 3 days where we could not wean sedation. We couldn't get him off the ventilator. We couldn't get him off of the tracheostomy to trach collar, which allows you to kind of talk with the trach in place. And so I would make it a point as a fellow to go to bedside when the neurosurgical team came around, or the ENT team came around, to clear that C collar. And I just remember he'd sit there, he'd hold my hand, he'd write notes on the tablet while all those people were in the room, and he'd just show it to me. He's like, "These white folks trying to kill me." I'm like, "All right." They're like, "What do you say?" I'm like, "No, don't worry about it." So I stood there, and for the 15, 20 minutes it took to wean sedation one day, I just held his hand and calmed him down, and like, be chill, man. They're trying to help you. They're trying to help you. It's very uncomfortable. Just bear with it. So they finally came by. Were able to clear the C collar. We took him off the ventilator, so he just had his tracheostomy in place. And the next time I came in the room, typically you kind of wean the trach. There's a valve you're supposed to put in so they could talk, but he was so ready to be done. He was talking around the valve, and he would just say, "I love you, bro. I love you, bro." And that was my guy. He told me a story how he was out with some friends, and it was his friends that from the back of the car shot him, and he played dead. And
Hmm.
as soon as they left, he ran to somebody's house, and that's the only reason he survived. And we developed, a very good relationship. But I just know that me being there at that time, at that place, looking like myself, was what allowed him to make that part of his recovery.
I'm going to share a little bit of a sideways answer to this question, because I've had many positive experiences where you're acknowledged because you're Black and you're just there, especially in the military environment, where I ran into more Black people than I do when I'm in the middle of the Pacific out here. But when you're on the team making rounds and the troop in the bed being taken care of gives you, they're just happy to see that you're there and can look after them. But I'm going to share an event that's sort of like the Sanford and Son classic, where the Black wanted the white doctor. I, as you know, the first Afro-American trained by the military to be a neurosurgeon. But even before I could get to the residency, what we do for house staff is that for cover the emergency department at Walter Reed, which has now got a different name. Excuse my using the old name. That's what I know. But the resident, first year resident, would be in charge of the ER all night, and the intern would be the troll or his assistant. So I had the Black lady, middle class, well dressed, brought in her mother, who was having congestive heart failure. You can see it from across the room. And it was me and the intern there. Long story short, I went to check on the intern to see how he was coming along, make sure he stayed out of trouble. And the mom uh, was fairly happy with me showing up, but the daughter told me, my mother's being taken care of by Dr. So-and-so. I could tell right away this racism that we have against ourselves in the good old days, it may not be so apparent these days. So I said, okay, I won't make a scene. I just faded and waited. And I knew she should have been admitted to the hospital. So when he was making his final uh, determination of what should be done with this patient, I saw a frown on the daughter's face. And I went over and asked the young doctor, younger than me, to tell me what his disposition and plans were. And he told me he was going to send her home a couple of aspirins and have her checked with a primary care doctor tomorrow. I said, no, this is a keeper. Call the medicine department and have her admitted, because she's too sick to go home. And I went away. I faded again. And before the daughter could leave the emergency department, she came over trying to apologize. I said, nope, don't go there. You do not need to apologize, because I know you don't expect to see me here. But what I do hope you learn is that we can do this kind of work. You don't have to be white. And I said, no apologies necessary. Just remember that the next time you come to Walter Reed. And so that was probably one of the reverse moments where I enjoyed the fact that I had tolerated the struggle to get into Walter Reed because I had the mentors from Howard University that decided that it was time for Walter Reed to have a Black trained neurosurgeon. That was Jesse Barber. So we all help each other pass through this passage. But I think America can learn a lot from Black people who came from slavery to be where we are now with a Black president and a Black female vice president who's asked to do the impossible. But, you know, represent yourself well. Be honest with yourself. That's what I would tell any mentee, and try to be the very best you can be. And if you can't be smarter than the other person, just be the best you can be. And that would shine. And when you show caring to patients as a physician, it'll pay off for you in spades.
Thank you for that. I have another question. We've touched on this a little bit, but have you ever been the only Black man in the room, and how did you approach that situation?
I'll answer because I've been in the room, the only Black person. I've been on cruise ships, the only Black family on the cruise ship. So I just be who I am, but knowing that I'm representing not just myself, unfortunately, but you're representing other Black people who these white people or other folk may not ever see. And they make up their minds. So people have a tendency to do that. So just be the best you can be, and always be kind, considerate, and somewhat humble, but not like I started out, unwilling to show what you know and how well you can utilize it for the benefit of those patients and others that we serve.
I'll just echo. Sorry if you can hear my kid yelling in the background. I'll just echo that. When I first started residency, there were two, a Black female and a Black male, third-year senior residents who were there, but they left, and then I was alone. My second year, my third year, as I matriculated out of residency, they didn't have any Black residents take my place. And then in fellowship, it was the same thing. And there were no Black males on the staff on the family medicine department as well. So I'll just echo what Dr. Robinson said. You know, you want to be yourself, be kind, considerate, compassionate, treat everyone how you want to be treated, all the stuff you heard growing up and in church on Sundays. And, you know, I feel like I definitely had my fair share of interactions that started off negative, but while, you know, somebody may try to hit you low, you just, yes, sir, you know, how you doing today? Happy to hear that. Glad you're doing well. Meet them with kindness, and you'd be surprised at how those interactions kind of turn to be a positive thing. So just do the best you can if you're the only person there. So when the next person who comes behind you follows you, they have some doors opened based on how you kind of acted and responded to situations.
I'm gonna, it's not contrarian, but I think absolutely let your work speak for yourself. I would say what I've learned to be is reserved, especially in these clinical settings as you're in medical school residency. I say it's a privilege to know more about me or know about me outside of work. And I say that because the people around us, there's a lot of stereotypes out there. And sometimes, you know, we unwittingly affirm or deny some of these stereotypes. And what do I mean by that? You know, Black people love hip hop or rap, or politically we lean to the left, or this is the minority male in medicine panel. Black men are hypersexual. There's a lot of stereotypes that are out there, and you know, I wish we were living in a world that had moved past that, but we're not. And a lot of people that we're training under, you know, they've obviously been practicing for a while. So I always, what I've grown to do, when I started residency, I was extremely reserved. By third year, they're like, "Oh yeah, Dr. Bradley, you weren't talking at all." And I was like, "No, I wasn't talking when I was an intern." I wanted my work to speak for itself, especially when I ran into a speed bump in the beginning. I was like, okay, these people are not my friends. They can be cordial, they can be polite. My time at University of Chicago was phenomenal. Had some of the amazing people to work with. Highly recommend the program. But people being people, there's different things that can happen. Once they feel very comfortable or think they know you, they're going to start attaching all these things to some of the actions that you're doing. Um, a simple conversation about politics, all of a sudden it goes through the grapevine, and now you're, Black Lives Matter protesting in the emergency department. A playful tap on the hand or touching somebody's shoulder, all of a sudden, oh, it's assault. And without sharing too many, like these have happened. A playful tap on the hand, oh, Dr. Bradley assaulted me, or you get complained about, that's as an attending to trainees or even to your coworkers. Simple rubbing the shoulder at a colleague who rubbed a fellow person he was working with on the shoulder, or just kind of tapped him on this, and was pulled aside later on and saying, hey, this gentleman, he said he felt very uncomfortable with you touching him. Black men are hypersexual. That's a stereotype, that's a trope. But when y'all get up in the hospital, the relationships that you have with other people, physical relationships, as well as interpersonal, it doesn't take long to develop a reputation that can spread around your institution. It doesn't take long to have a case of he said, she said, or again, your reputation is all you have. And these are, I'm speaking of completely consensual adult relationships. Just be very, very mindful of the things that you're doing, the things that you're saying, how that's appearing to the people that you work around, because you've worked so incredibly hard to get to where you are. You don't want something like this to really derail your career.
Thank you for that. That's very real and necessary. And I just wanted to touch on something that Dr. Robinson said. He said that not only are you representing yourself, you're also representing like your whole, like Black people as a whole or Black men as a whole. How does that feel, kind of having that pressure on you, and how can you, I guess, alleviate that in a way, if that makes sense?
Well, since you quoted me, I'm just going to tell you, I've sort of learned to ignore it, but also to be cautious, because we end up becoming special. Not that we decided we were going to be special, but because that's just the way it is. The world judges you as what they already have stereotypes, as just mentioned. And if anything happens that fuels that stereotype, and one of the sad things is, if you really are good and exceptional in the competitive world still of medicine, they'll use anything to tear you down, to stop you. And so, whether you want to realize it or not, you are representing more than just yourself. But more importantly, you are representing yourself. And as we sit here right now, I'm not sure that I deserve the accolades or the praise, because I just feel like I do what we all should do to help each other through this passage. And I even venture to think, what can we do to help America become a really great country? It's already impressed the world, but it could be so much better if they could recognize every American equally and help them to help our country be the best they can be, instead of starting fights and wars. Abraham Lincoln couldn't have said it better. You're divided against yourself, as we are right now. You end up having crazy stuff happen like the Civil War. And so Black people, of all people, we're the ones that have the most to be apologized to for. Yet somehow we are always the ones having apologized. And so the only thing we can do is represent ourselves and our race as ambassadors toward that goal of making America realize that all of our citizens are worthy of being supported to contribute to the greater cause of all of us. That's very philosophical, I know, but think about it. The ups and downs of American history, and I'll venture into politics a little bit. It's just sad to see where we are now compared to the strides that we've made over the past 4 or 5 decades to come to where we are now. So we are ambassadors of ourselves and our race and other categories, but including the country. I shut this old guy up.
No, we really appreciate everything that you're saying. And before I go to the last couple of questions, if anybody is listening that has a question, you can go ahead and comment that, and we can ask those questions. But while we're going, my next question is, how do you stay motivated when times get hard? For example, in school, when just exam after exam and you're starting to feel burnt out and exhausted, how do you stay motivated to keep going?
I'll say know your why, know why you did this in the first place. For me, I look back a lot. I'll look back at the end of my first semester of medical school. I look back to where I was at the beginning. Like I didn't know any of this stuff 6 months ago, or I wasn't even in medical school 7 months ago. And I am a person that sets countdowns because those help me appreciate and remember where I am in the moment. But some of the most inspiration you can possibly have, in my opinion, is to look back and see how far you've come.
I would echo that. I've experienced something called like the 5-year rule or the 1-year rule, whatever time frame. Looking back at a set amount of time, where was I 5 years ago compared to now? I was in my third, fourth year of medical school, afraid out of my mind that I was going to match somewhere, and I hoped that I liked it. Now I'm attending, did my residency fellowship, yada yada yada. So instead of looking forward and kind of being almost overwhelmed by that next test or this next block or this upcoming rotation with that one surgeon who you're a little bit concerned about based on what you heard, look back on how far you've come. I think that was helpful for me. And then just keeping the why, like Dr. Bradley was saying, in mind. My motivation is what kept me going.
Well, for me personally, I had no option. Not making it was not an option. I had so many people from the hometown um, depend on me to keep on keeping on and to prove them proud for having supported me. So I found it pretty easy. Not to mention I had got married before I went to medical school, and my young wife, we were both young. Failure is not an option. So, but I also have some of the same principles that Dr. Bradley and Dr. Nelson have. I've always had, sh- put always in quotation marks. It gets different when you get older. So I used to have a 1-year plan, 2-year plan, 5-year plan, 10, 15, 20. At 79, I sort of got to that point where I said, just stay out of trouble, keep the faith, and try to keep representing well, as I'm trying my best to do today. So you do have to have that stubborn determination. That's how I phrase it, stubborn determination. Don't give up. Have stubborn determination to succeed. And, it will sustain you. It's never going to be really super easy. It's the business of medicine changes so much. The stuff you learned 10 years ago, you've got to relearn a lot of that stuff, and you got to stay up to date. You don't have the the joy of being able to cruise. You're always going to be learning. Even when you retire, they're going to ask you questions at the medical association if you keep showing up, and you got to be able to represent. So stubborn determination. Don't give up.
Thank you for that. And we have a question in the chat. It says, "What are the traits or habits that set you apart from your peers while matriculating through medical school and eventually your professional career?"
I'll say I listen to everybody. I make people feel heard, from the OR nurse to the circulators to environmental services to most importantly the patients. Um, I force myself, and I have more time with the luxury of being an attending. Um, but I ask the patient, "Oh, what do you do for work?" And I try to force myself to ask a second follow up question just to make sure I'm centering on that person. And your attendings may not appreciate that or pick up on it now as a resident, or your residents may not appreciate it as a medical student. But what you're showing and modeling to the people around you is that you care about people first and foremost. And in doing so, you're gaining allies, you're gaining trust, you're gaining respect of everybody around you, from the physicians to the nursing staff, and onward.
I'll echo that. I think that's um, great. I'm the kind of person who tries to keep in mind, the nice, beautiful, multi-million dollar hospital. No one's going to go to it if, you don't have someone who's cleaning up, taking out the trash, picking up behind you. Like, treat everybody with respect. Just because you decided to go to medical school and become a physician doesn't make you any more valuable or less valuable, in my opinion, at least. Um, and I would also say just general like determination. I think back to some of my, friends who wanted to similarly kind of become a physician and all that kind of thing. And, you know, um, just keeping that goal in mind and being determined, you're going to get knocked down. You might have a rough test or not get a concept, but that doesn't mean you're not capable and not able to, uh, continue to kind of chase that dream.
I would just add to all of what Dr. Nelson, Dr. Bradley have said that medicine is a team occupation. I started to say team sport, but it's far more complex than a sport. You might be a neurosurgeon or a heart surgeon or whatever kind of surgeon, you may be the best there, but without the team, you aren't going to be able to be the best that you can be. So that's all I say about that. It really does take the recognition of all those that work with you, that you are a team. Again, together we stand, divided we fall. If somebody else wants to be the head honcho or the star and not recognize the team, you got trouble.
Thank you so much. If nobody else in the audience has any questions, I just have one last question to kind of wrap this up. So, what is a one final piece of advice that you wish you heard or wish you knew while pursuing this journey?
Since no one's speaking and I'm not sure what I'm going to say, but I can't really think of anything because for me, and I think for most docs, even though I can't speak for most doc, medicine was more of a calling. The last thing I really wanted to do was be a physician. I like airplanes. I wanted to fly, but I hadn't met any Black pilots. Back to mentoring. But I was kind of mentored by a relative of the commentator Joyner. In my hometown of Plant City, Florida, there was a Dr. Joyner who I didn't find out later that he's the grandfather of the commentator that you all probably know of, Joyner. And that sort of stuck. All that other stuff, the physician, the trumpet player that I was, it just faded. And I found myself being a physician. So I'll have to leave it there. I think it's like a calling. It's not something easy. You see doctors and nurses or health professionals, they work their buns off. And COVID was an unbelievable example. I mean, even at your own sacrifice of your own health and family well-being, you're out there doing something that you only do unless it's a calling. So I can't think of anything. I think medicine chose me as opposed to the other way around.
I'll, Dr. Robinson will know this one. Equanimity under duress. The ability
Yes.
to remain calm and collected in the face of challenges and adversities. That's a quote from Dr. Lasella Fall. I think you may have got that initially from Dr. Charles Drew. But that quote, equanimity under duress, was the way he lived his life. He was always cool, calm, and collected. And we spoke earlier about mentorship, and a lot of it's modeling. And I was fortunate to be able to try to model that behavior that was exhibited working under Dr. LaFall and all those great faculty members there at Howard, and it served me well thus far through my career.
Both of those are great. I'll just try to add my little perspective. I kind of mentioned it before. Don't compare yourself to other people. Compare yourself to yourself. You wake up, you have a really terrible day, wake up the next day, and hey, it's a new one. Where am I now compared to where I was in the morning when I woke up? What did I learn? Whose lives did I have a positive influence on? Just try to find that little bit that you accomplished that is a positive, and reflect on that. Don't reflect on the negative, which is so much easier to think about and kind of fester on. That's what I would say.
Oh, so we have a question in the chat. What are some methods you gentlemen have used to pacify situations in which you feel you're being discriminated against?
You got to know your policies and procedures in and out. Whether you're in residency, there's a contract that you have signed. Whether you're in your attending job, you signed a contract. There's HR. So know what is legal and what is illegal and what works based on policy. We had instructions in the military that everything had to work under. And if people are breaking the rules that are already established, it's a matter of documenting that and calling it out.
I would add documentation, paper trail is ideal. Also potentially having the mindset of where you are in the hierarchy. If someone above you on the ladder is discriminating against you, I would reflect on the policy and the procedures. If you have someone lower on the hierarchy discriminating against you, or you are observing it happen, I would do my best to address it appropriately at that time, whether it be if it's a patient and they're dismissive of, a physician because they are female or because they don't look like the patient. That's not what we do here, Mr. or Mrs. So-and-so. Like, Dr. So-and-so is more than capable of managing your care, and I have my full confidence in them. Or, if it's like a, resident or another learner on the team, taking them aside later on and trying to address that situation, just being proactive and keeping that kind of hierarchy in mind. So you don't overstep where you are, but you also have some control over the situation.
I'll share a little bit of an experiential episode in my professional life that echoes what both Dr. Nelson and Dr. Bradley have already said. But I was being attacked by my entire company after I helped build a company here in Hawaii. And I just happened at that time to run into the Tuskegee Airmen, the group of them that came out here every February during Black History Month. And Colonel Alexander Jefferson said, "Bernie, you got to learn to play the game." Now, I'd been in the game a long time, but those words registered. You got to learn the rules, you got to know the regulations, and then you got to try to make sure you maneuver so you don't have a simple me versus them. You need some converts to see your side of the picture before you make your move. And of course, your move may have to get to the point of getting legal assistance. Hopefully you can avoid that, but it may be necessary. You should always have that in the back of your mind if you feel you're being discriminated against. But you may also think about being a little more bold and courageous. First, do get someone to confirm that they believe you are right, that you're being discriminated against. And if you can find someone that's formidable to support you, that's a big help. Then you might do something that you may not think of. The individual or entities that are discriminating against you, you may want to arrange a meeting, call it a mediation session. And it's interesting how even the most racist of person hates to admit they're racist. And sometimes it's resolved and you can have them prove for the rest of your tenure with them that they're not racist. Doesn't always work, but it can work. But since you asked the question, that gives you something to think about.
Awesome. Well, thank you all so much. We don't want to take up too much of your evening, but thank you all so much for all your insight and advice on this panel. We really do appreciate it. Things were very helpful. And thank you again for staying tuned, to all of our audience, staying tuned for this panel. We really do appreciate it all. And yeah, have a great night, everyone.
Okay, thank you. Pleasure meeting the rest of the panel. And if you ever end up in the middle of the Pacific, let me know you're coming. I would love to meet you in person.
I'll be there in March. I'm gonna email you, Dr. Robinson.
All right, that sounds good.
Y'all have a good one.
Take care.
Good
Aloha.
night, everyone. Bye. Thank you.